welcome to another day at EACTS. I'm Alice, I'm here with CTSNet, and we've got the amazing Professor Friedhelm Beyersdorf, who is past president of EACTS, past editor of the European Journal, studied at medical school and trained for most of his career in Germany with some time spent in the States. Amazing in your field because you started publishing as a medical student and have now published over 700 publications. And we're going to talk to you today a bit about innovation in our specialty in cardiothoracics. What would you say has been the biggest innovation changes you've seen through your career so far?
I think right now we are living in this phase where all the innovations are being implemented and will change our field. That means in the past we had changes in one area. So let's say we started with robotic surgery a little bit. We started with aortic surgery, with endovascular stent grafts and so on. But these were little changes, still little compared to today. Because now we are living in a period where artificial intelligence will change us completely. We are living where synthetic biology is changing life completely. We are able to produce life from the computer, which has not existed before. We do have robotic surgery on a completely different level. We have nanotechnology. We have quantum computing techniques. All this will lead for us to a much better patient outcome. And our goal is now to implement these changes to improve our surgical techniques and to improve the outcome for the patients so that they can hopefully go home much faster with low comorbidity, with low perioperative complications. We are all convinced that we will be able to use these new technologies to achieve this goal.
Great. It sounds, it's very exciting, especially someone like myself at the beginning of their training, that, it's going to be so different and all for both the surgeons and the patient's benefit. What would you say, you've briefly touched on some areas, but what would you say are like the biggest areas of innovation you think are coming?
I think right now, one of the biggest fields will be artificial intelligence.
Okay.
Because this will change our pre, intra and post-operative treatment. However, we do need a robust database for having artificial intelligence. It doesn't fall from the sky, so we have to have a robust infrastructure, and this has to be implemented in all the clinics. And for example, this is one concrete action point from our innovation committee to have a software available to all the clinics where all these thousands of data which we have already from the heart-lung machine, from the OR, from the preoperative diagnostics, from the ICU, that they are all there gathered and finally can be used for AI, and AI will help us to improve our final treatment.
Great. It sounds, we've got this data, we just need to make the most of it.
Right.
And as you mentioned, the Innovation Summit, so you are now chairman of the EACTS Innovation.
Yep.
So what is EACTS going to be doing to help the specialty and help trainees come into innovation as well?
So we all see that, as I just mentioned before, that is exactly the case. No, we cannot stop just by talking, we have to do something. And that's the reason why EACTS has now founded this Innovation Committee, Innovation Summit and Innovation Grants in order to have a strategy to implement these new opportunities into our daily treatment. And of course we know that's easier said than done, but on the other hand, the speed with which AI, for example, is developing right now is breathtaking. And I also know that there are several aspects which might create fear in people. And this is not unsubstantiated, it's right. But for sure, it will be beneficial in medicine. And therefore, it's our goal to use this new technology, not only to look to the potential and probably actual side effects, but also to use it for the well-being of our patients and to change even whole surgery. So we are really now in the process of changing surgery the way it has been done, let's say 50 or 70 years ago, that's gone.
Yeah.
And we change it, and therefore it's a huge opportunity for us right now to do that. I mean, it's not occurring every day and every year, you know, but now we are in this period, and therefore you and all other young guys are really perfect. You will hopefully love it, even though, as in life in general, there is nothing only positive, okay? There is negative sides and positive sides, but one has to look to the positive side and take the most advantage out of it.
Great. And if you were to say someone, a junior, who wants to get involved, what would you say are the best ways they can get involved?
Best get involved would be to be a member of the innovation committee. There we have certain topics ranging from AI to robotic surgery to lymphatics to the future of the heart valves, and to another great area, which is prevention of cellular damage in the perioperative phase.
Yeah.
So once you're a member, then you can still use whatever topic you would like to be involved, because everybody has different interests. So that would be the easiest and next step, and this is open to all EX members.
Great. Thank you so much for talking to us today, and enjoy the rest of the conference.
Thank you very much for the
Thank you.
interview. Thank you.